Ko rangitoto te moanga, ko waitamata te moana, ko Ngāti Pākehā o te tai tokoro, ko Ngāti Airani ngā iwi, ko Clendon, ko Wynyard, ko Pā ngā hapu, I tipu aki ai ahau I papatoitoi, kei Counties Manukau Health ahau e mahi ana. He kai whakahaere mō ngā nihi ahau, ko Jenny Parr taku ingoa. I'm Jenny Parr, I'm the Chief Nurse and Director of Patient Whānau Experience, as Robin's just said, at Counties Manukau. And even though I have a bit of an English twang to my accent, I am actually from South Auckland and was brought up and did my training at Middlemore. Achieving wellbeing requires positive social exchanges and action between staff and patients, between staff themselves, and staff and leaders. I mean, at the end of the day, we're going to get what we give and give what we get. The response of our staff to the way we support them in practice will totally reflect what we invest in them, for better or for worse. Investment in social and environmental capital and human capital, such as the wellbeing funding, needs to deliver on culture, which includes excellent relational leadership, clinician engagement and governance and leadership, valuing evidence-based practice with the right number, the right skill and the right demographic of staff. It needs to provide for their physical safety with an unwavering stance on zero tolerance for workplace violence and supporting personal resilience through opportunities for recovery and development. I'm going to cover 3 tenets to enabling wellbeing in our health sector, and I think it will balance nicely what we've already heard. It's important, I'm going to cover the use of evidence and practice to target specific care needs, knowing our workforce and their specific needs, and providing a practice environment that fosters personal resilience and great care. At the centre of all the work we do must be the patient, consumer and their whānau, establishing and preserving effective relationships with them to enable great care and achieve excellent outcomes. New Zealand nurses were asked in 2013 about the factors that influence their ability to thrive at work and enjoy working as nurses. A key driver was altruism, based on being able to engage with patients and make a real difference. Nurses want the lived reality of nursing to meet this expectation so they feel positive about the work they do and avoid the negative stress that leads to compassion fatigue and burnout. At the end of the day, they want to be able to function in the way depicted in this picture, a mutually invested relationship reflecting reciprocated commitment, which results in obligations to provide and participate in care. Our organisations are the context in which this altruistic behaviour occurs, and an organisation either enables it or creates barriers that nurses perceive as hindering their ability to relate to and support patients. We've already heard how practice is complex. It's challenging, emotionally draining, and also rewarding at the same time. The work requires specialist knowledge and skills and the use of evidence-based practice. Understanding that a range of events can lead to a trauma response, which can have potentially negative effects on behaviour, mental and physical health. We need to also appreciate that adverse events have been shown to negatively impact on brain development, physiology, behaviour and relationships across the lifespans and through generations. They might come from adverse child events or adults who've experienced some form of abuse, partner violence, violence by non-partners, crime, active hostility, workplace, physical violence and bullying are also at risk of developing mental health issues. In fact, 50% of the general population is impacted by trauma. 70% of Māori and 80% of our prison population, 90% of the people accessing mental health and addiction services have some form of trauma. So this requires a care model informed by evidence about responses to trauma, So providing trauma-informed care on the right of the screen is critical, and you can find out more about that from the exhibition outside. Trauma-informed care is strengths-based service delivery that's grounded in understanding and responsiveness to trauma and the impact of that emphasises a physical, psychosocial and emotional safety for both providers and survivors. And there's a real alignment with this to ensuring that fundamentals of care are also practiced. That is, that relationships are established reflecting a commitment to care, providing a platform for mutual trust, anticipation and focus on relational, physical and psychosocial care needs. As an example, mental health nurses focus on engagement with the consumer, their tangata whai ora, and developing trust is critical to supporting a person's return to wellness. And more, the return to wellness includes an acknowledgement of a person's spirituality, their family whānau, and recognising what's important to them, what matters to them the most. Supporting patients to engage with their condition and learn self-management requires relational energy. It's not about task and time, but about thinking and linking in the moment, knowing, anticipating and evaluating the care that's provided. The balance between managing necessary tasks and the emotional challenges in providing great care for patients needs to be valued by us as leaders, or the tasks will take over. It's clear that to be successful, we need to provide a culture and environment that is truly patient outcome-centred, rather than task-focused. Everyone who works in mental health or in any area needs to be highly attuned to the need for better outcomes for Māori. There's a focus on doing more and understanding our own potential biases. We need to invest in a workforce that can professionally respond to the complex needs for patients, for people's wellbeing in areas that include addiction, disability and corrections, and mental health, and across the entire health system. Te tiriti o Waitangi, in its purest context, is about and informs relationships and must inform all approaches to care. We need to realise a demographic workforce which reflects our population. This is critical to the nature of nurses and other clinical professionals' work. You might wonder why I put a picture up of a whole bunch of students not at school. Well, I guess what I'm trying to reflect here is that our workforce is made up of a number of groups, and millennials are a really key part to that, as is those in middle age. In fact, we're overrepresented in health when you compare our employed staff to across New Zealand. Millennials need from us a deep sense of meaning. They want to make a difference. They want a work-life balance. They want positive workplace cultures and rely heavily on integrity and values. They want to work on complex problems, and they also want to have a real connection with visible leaders. Team cohesion is really important to them, and they need that in order to be able to be fully present at work, in order to be able to engage with patients, but also to be able to engage fully with their families at home. Work-life interference and conflict won't be tolerated by our staff, and we cannot afford to ignore it as an issue. In a complex, stretched and stressed health system, opportunities to recover from stressful work situations are becoming more scarce, but ever more important. Younger nurses have lives and families outside of work, and 50% of nurses over 50 are now thinking about retirement, and this accelerates with age. To retain both groups and allow them to thrive and want to work, we as leaders need to understand their issues and engage with them in developing workforce management approaches that support their lives. Staff need effective, supportive leaders who possess integrity and approachable, can tap into their motivations and create and sustain positive, fulfilling practice environments where they have the knowledge and skills to provide the complex care and enable them to make a difference to society. Nurses are in demand due to their problem-solving skills, professionalism and sense of clinical duty. They have highly developed interpersonal skills, and we're very easy to work with as well. For that reason, we must ensure that nurses look after their own well-being, and we provide them support to enable that to happen. Thriving at work is shaped by the context in which they're embedded, as I've said before. It's a feeling of being alive and energised at work. When was the last time you felt like that? Feeling absorbed in your work, feeling that you're making a positive difference and that you're always learning how to become more effective. High workloads and work-life interference can lead to stressed managers being more demanding than supportive, and colleagues being driven by their own demanding work. We need to finish the job of achieving safe staffing to be able to deliver the nature of care that's required, which is complex, that takes time to achieve, that is relationally competent care. We need to develop the skills and confidence of staff to support people accessing services with experience of trauma. We also need to maintain cultural connections and understand frameworks towards healing and recovery. Above all, nurses need to feel valued. Support and recognition from colleagues is a major factor in enjoyment of work. Managers and supervisors need training to understand how to develop supportive teams and reduce bullying. We need to focus on strengths and focus on how and why things go right more often than not. This requires that we all demonstrate respect for each other with each profession, knowing their role and place in the delivery of healthcare. But a culture of wellness starts with how we behave towards each other, both when it's going well and when we're under pressure. Emotional hindrance demands need to be minimised. These factors, such as bullying in the workplace and violence and aggression from patients, are really problematic. Workplace safety is a legislative responsibility that we hold. And any organisation, which basically means that we have an obligation to develop and support nurses to thrive rather than just survive their demanding jobs. I doubt any of us in this room would say it was okay to come to work and feel either psychologically unsafe or physically unsafe. However, increasingly, it's becoming more difficult to assure physical safety of our staff. I remember the impact on my own well-being when I was in 2 armed robberies in the 1980s. Well, I was brought up in Papatoe and running a pizza delivery shop at the time. You might say I was unlucky, or perhaps I shouldn't have put myself in that position where I could be subject to this type of crime. However, in our healthcare, staff are at risk every day. I was told recently of a conversation with a research team who were trying to determine how much violence was tolerable for their project in ED, until they realised that actually no violence is tolerable. We already understand the impact on society from trauma, and this extends to our staff. We have a responsibility to provide them with the skills and expertise to de-escalate beyond those in mental health, and generate a culture of zero tolerance to workplace violence. And that's down to us. In summary, we need to enable and expect positive relationships at work, within teams, across teams, and throughout systems. We need to support staff by taking a stand for zero tolerance of violence and aggression towards healthcare staff. We need to achieve safe staffing, which enables nurses to have time and energy to invest in emotional engagement with patients and recovery time for themselves. We need to use evidence-based practice such as trauma-informed care and fundamentals of care, enhancing confidence and capability in our staff to support people's returns to wellness. And finally, leadership is critical to enabling wellbeing. We cannot achieve mental health wellbeing for our patients or staff if we do not expect or equip leaders to prioritise this with authenticity across the system. Nō reira, e aku hoa mahi, tēnā koutou, tēnā tātou katoa.